Starvation mode is a really tricky phrase because people will tell you, healthcare professionals, fitness professionals, people who make supplements and power bars and snacks and all these things, they will tell you that it's really important to never get hungry, or your brain will be tricked and you'll be in starvation mode, and then your metabolism will shut down or you will binge. And that really is partly true and partly untrue. It's true if you believe it. It's untrue if you understand your physiology, because hunger doesn't mean you need to eat. Hunger means your brain is signaling you, is it time to eat now? And your brain will do this just like a little kid in the back seat of a car on a long car trip. They'll just keep going. Are we there yet? Are we there yet? Is it time to eat yet? Is it time to eat now? How about now? That's what your brain will do until you start to train yourself to have a little bit of hunger tolerance. It would be the same as like bowel and bladder tolerance. Every time you need to go to the bathroom, you don't go just then. We don't wear diapers. And God forbid, I suppose if we go along the same way that we do with how we're treating our hunger, like it has to be indulged immediately, maybe we all will be wearing diapers because it would be too hard on our bodies to have to hold it for a few minutes until you get to the bathroom. But the reality is we get physiologic signals from our body. We get these signals, like you might feel like, oh, I have to go to the bathroom. And you go, oh, I probably should go to the bathroom. It's been a while since I've gone. But you wait until you have a break, or you have an appropriate time and place to go, and your body learns that you will respond to the signal in the proper time and place. And that's how we need to respond to our hunger. We need to respond to it in the proper time and place. And historically, we always did this in the context of the meals of our family. So just think about how a child would become socialized about what is appropriate time and place to eat. They start off being breast or bottle fed with mom. Food is brought to them, a lot of times on demand. When the baby cries, then we feed the baby and they stop crying. And they learn to ask for food because they start to understand what hunger is, and then they cry for food and their hunger is satisfied and they feel better and stop crying and go to sleep, wake up, cry some more. Then this baby becomes older, becomes a child, and starts to observe the family and wants to become part of the meal with the family. So they have still a little stomach and not a very well developed digestive system, just like all young animals, like a puppy or a kitten, and they need more frequent eating intervals. But you have to train the longer one, because if you keep feeding them all the time, then their body doesn't learn how to train a little bit of hunger tolerance so that they can eat at the appropriate time and place. So we all know that a lot of times children will go, I'm hungry, and we feed them now. But we didn't used to do that because it was a big deal to feed a child. You had to prepare food. There wasn't just some snack or random thing you could get out of the cupboard. So what we do is we say, well, we're going to have dinner in an hour, or we're going to have dinner in 2 hours, and you can wait. And maybe the child will go, no, I'm so hungry, I'm starving. And you just have to gauge it from child to child. But we know that they're not starving, and they're not going to learn to be able to tolerate hunger, and also to train their body to use the fuel that we carry around that's designed to be used that way while we're fasting. Like when we're asleep, that's why they call breakfast break fast. It's the food that we eat after we've been fasting since the day before. So our bodies are designed to be able to run on fat after a period of time after we haven't eaten anything. But if we constantly are topping off the tank and we're acting like a grazing animal, which we're not, then we aren't really going to learn how to manage our hunger appropriately, and we're going to get anxious whenever we don't have food available right at that very moment. So it is really important to give yourself a lot of opportunities to acknowledge that you're hungry and say, I'm not going to eat yet. A big mistake that people make is they go, oh, I'm hungry, but I can't have anything to eat. And your brain doesn't like that, because that's restricting. What you need to do is say, oh, I'm hungry, But that's okay because I know I'll be eating at this time in this place, and then do it. And then your brain develops a sense of trust and you develop a lot more hunger tolerance. It will just go away. And what you find is when you are hungry and you make an inevitability factor, you can't eat at that time. So obviously, there would be a place where food wouldn't be available, or you needed to fast before surgery, or there's an enforced circumstance of hunger. When your brain really understands that you're not going to eat, no matter what signals it'll give you, it stops bothering you. So you have to have a lot of time and patience to practice this, just like if you were training a dog and they're begging you for treats all the time. You can't expect 2 or 3 times when you don't give them a treat that they should stop begging. But after a while, they'll learn, I'm not going to give you a treat, so then they'll stop begging you. And that brat in your brain, that middle part of your brain that we need to train, it will stop begging you too if you just stop indulging it. And the worst thing you can do is to give in some of the time and not the other time, because then the brat in your brain will act just like other brats. It will just start to scream louder and louder and really torture you. You just have to stay firm and calm and stick to eating at a reliable time. It's not about not eating. It's about not eating yet.